there is good news. All right? So 5 to 10% of weight loss, okay, improves heart disease risks and high blood pressure. And if you look at this list, think about anybody you know or yourself if you would benefit. Cancers, breast, esophageal, stomach, colon. We're going to hear all about cancers later today. Arthritis, diabetes and insulin resistance, carpal tunnel, sleep apnea, daytime sleepiness, breathing problems, risks of clots, kidney disease, gallbladder, liver disease, pancreas, gout. Not sure what happened to our formatting here. Wound healing, inflammation, perioperative, if anybody has a joint replacement they're going for, right? I get a lot of referrals for that. Weight loss of only 5 to 10% of your weight makes all the difference. It helps, right? So let's get that right. All right. Not sure where I should point this. Maybe, can you get some help with these?
Can you point to the top?
All right. So, a lot of people think about, all right, I'm going to lose weight. There's many different ways to lose weight, and we know that. Many of us have tried different ways. So number 1, severe sickness. This is not a way we like to do this, but you know, if you've had the flu and you've been vomiting, you might have had some weight loss. Or if you have cancer, a thyroid disorder, kidney failure. There's many ways that people can lose weight. Medications. We know medications such as chemotherapy, right, will cause us to lose weight because we don't feel good and we're not hungry. And then there's medications that are intended to cause weight loss, like weight loss medications. Number 3, counting calories. This is a big one, right, because this is what we've all been told for years. Eat less, count your calories, eat less calories than what you normally eat. And the problem with this is counting calories works if we were in a vacuum and we were a robot and our bodies didn't adapt to the environment. But if we keep shrinking our portion sizes and cutting our calories, what happens? The body adapts and the metabolism slows down. And so that becomes ineffective after a while. We regain the weight and we're wondering, well, I'm hardly eating anything. Why am I gaining weight? Why am I not continuing to lose? Because your body caught up with you and said, we're going to survive on much less calories. And then the 4th way, the reason we're all here today, we want to learn this one, right? Maximize fat burning. So that's going to be the next. Now there's many fad diets and weight loss failures. And many of them are unhealthy or cause only temporary weight loss. They cause us to feel bad. They might make it really hard to continue. We feel like we've slowed down. We've been told this calories in, calories out. And so much of the time when I first started, I used to tell people that same advice. And I couldn't understand why people weren't able to keep the weight off and why they were getting depressed and tired and not wanting to work out anymore, and everything just sort of seemed to get worse. And I would ask my colleagues, and they would say, your patients aren't really telling you the truth. They're not really doing what they're supposed to be doing. They're probably eating a lot more, and they're just not telling you. Or maybe they're really exercising much less or not at all. I thought to myself, that can't possibly be true because I'm the trainer in some of these classes, and I see them kicking butt, all right? So it's not somebody's fault, right? If we've been doing the calories in, calories out, and they're not losing weight, that's not that person's fault. With these fad diets and weight loss failures, we also have no long-term plan often, right? It's a 12-week program. I have patients come in asking me all the time, how many weeks is your program? Well, it's a lifelong thing, right? So yo-yo dieting. If we've had the experience of yo-yo dieting, the problem is our body learns to gain weight, and it gets better at that. And that's why people gain more and more. So again, I have to always remind people, not all weight loss is healthy. It's unhealthy if you lose muscle, if you lose too much water and become dehydrated, or if your organs actually are shrinking because you're not giving yourself enough nutrition. That's not good, right? It's healthy weight loss if you lose that extra that you don't need, all right? That unhealthy fat specifically around the waist. That's what we're aiming for. All right, so the goal is healthy weight. You want it to be maintainable and that it should result in you feeling healthier and feeling great, right? Your body should actually be healthier as a result. Lose unhealthy fat, stay appropriately hydrated, maintain or even enhance your muscles. Keep those organs healthy and functional and feel energetic and vibrant. So elements of a healthy plan. You got to lose the unhealthy fat. You want to plan so that you can maintain it. And remember, if weight has ever been a problem for you in the past, you never hit the goal weight and then be done with it, right? It's forever something you have to be aware of. And so that's why we're talking today about a way of eating that's going to provide you a lifelong of success. You also want your plan to be healthy for you, help with your health and wellness, and help you feel better. All right. So, you were destined to thrive. The human body is designed to be healthy, right? It's designed to heal. And that's where we're going to go. Okay? So first we're going to do a little mini medical school, and all of you probably know this, but I want to make sure we start on the same page. Now, we know that glucose is blood sugar or fuel for the body. And you have to have some. If you had zero, you'd be dead. Right? So using teaspoons, tablespoons, and cups, how much sugar has to be in your bloodstream to have that perfect amount? We know 1 teaspoon, right? That's great. Now, we also know that very, very high levels of sugars are no longer fuel. They become poison, and they poison every cell in the body. How much sugar has to be in your bloodstream to get a diagnosis of diabetes, which means it's in that very high poisonous level, causing blindness, kidney failure, heart attacks, strokes, cancers? How much sugar would have to be in the bloodstream to get a diagnosis of diabetes? About 1 1/4 teaspoons. Okay? Isn't that mind-boggling? The difference between 1 and 1 1/4 teaspoons is fuel or poison. That's how powerful that is, okay? And we have one defense. It's the only one. It comes from our pancreas that sits behind our stomach, and it pumps out insulin anytime those sugars start skyrocketing because your body wants to survive. So it's going to try to protect you, and it's going to pump out that insulin. And what does insulin do? Brings down the sugars. Yahoo! Okay? So let's first just pause for a moment and think. There's 3 kinds of foods that we're going to talk about. Or really not talk too much about, but that you should know about. And they're fats, like butter, cream, right? Proteins, like meats, chicken, fish, eggs. And then carbs, like bread, pasta, potatoes, rice. And they're going to affect our blood sugars differently. So let's do a little quiz, okay? I'm in an academic center, so we do quizzes a lot. All right, so a 12-ounce can of soda. How many teaspoons of sugar are going to get dumped in your bloodstream from a 12-ounce can of soda?
10.
About 10-ish, plus or minus 2. All right? Your body can tolerate 1. What about the plain bagel that we've all been told to eat because it's low fat? Okay? What do you think?
15.
About 12 to 18, depending on the size of your bagel. Right? What about that 100% whole grain bread, that one slice, a little slice of bread, because I only have the top bun or the top piece of bread, right? What's up with that? How many teaspoons?
23.
4 to 5 teaspoons. All right, even if we're just having one lonely little piece of bread, okay? Now let's go to this chicken. Now I've been told not to eat dark meat, take the skin off the chicken, let's go boneless, skinless, forget it. Let's put the skin on it and eat the dark meat, okay? The best part, right? How many teaspoons of sugar are we dumping in our bloodstream there? 0. What about that awesome T-bone steak, which we've all been told we shouldn't be eating, but that's so good for us? 0. And then what about the lettuce? Very, very small, negligible, okay? Not even at the teaspoon, obviously. So if you look across here, I don't know about you, but I definitely prefer that bottom row of foods anyway, so yay for us, okay? So what's the problem? What causes those blood sugars to spike? Yeah, it's all those carbs, right? Does this give you a clue? Yeah. All the stuff that's kind of pasty colored. Okay? I don't want to be pasty. I kind of am right now, but it's the pasty foods, okay? So that's going to cause your blood sugar to spike and your insulin to spike. And we know what insulin spiking will do. So let's go there. We eat carbs. Our sugar levels rise, and they go pretty high, as we saw. The pancreas pumps out insulin. Now, what does insulin do? Well, it turns off our fat burning and it causes our cells to start growing. And the reason it does that, you turn off fat burning so that it forces your body to use the sugars in the bloodstream for fuel, right? Because you're trying to bring down those sugars. So first it's about survival. And if you are not running a marathon all the time, you're probably not going to burn off all the extra sugar from that piece of bread or that bagel. And so all of that extra sugar that can't be burned off at that moment has to go somewhere because otherwise you're poisoned. So where do we have infinite storage space that we could put all that extra sugar? In our fat cells, right? And that's exactly what happens. So, but the good news is our sugars are dropping, all right? So that's good. And what happens after that? Your body starts starving for fuel, all right? Now, if you've been doing this cycle frequently, you're going to be hyperreactive and your body starts pumping out extra insulin, right? It's like, oh my gosh, here we go again. I'm just dumping out the whole bucket. I'm not going to measure out the perfect amount. So your insulin, there's a lot left over, even though you've sucked out all the sugars out of the bloodstream. You can't tap into those fat stores to get your backup fuel. That's been shut off, right? Because your insulin is still high. So what happens? You get hungry, really munchies, that hangry. You've all heard about that, right? Your blood sugars feel like they're plummeting. You feel terrible. And so what's one of the best things you can do if you didn't know any better? You could go to the break room, and what's always sitting in there? Some kind of Dunkin' Donuts, carbs, the best pastries that your family is wanting to share with you. When you continue to repeat this cycle, your body starts overreacting and it leads to insulin resistance. And insulin resistance means that your body stops listening to insulin as much. And so then this cycle becomes more and more extreme because your body's like, oh, you're ignoring me? I'm going to give you even more insulin. So then the cells start resisting even more. They're like, too much. And after a while, you stop being reactive to insulin. So then the sugars don't have a place to go, right? The cells start ignoring the insulin. So they stop accepting the sugar. And now you start developing prediabetes, diabetes, and the list goes on, okay? Oops. So, signs and symptoms of insulin resistance. You know this is happening if you experience an enlarging waistline. If you notice that the skin on the back of your neck or in your armpits are getting darker. If you notice extra skin tags popping up around your neck or your armpits. If you are feeling especially tired after eating. If you feel hungry all the time, right? You're like, every 1.5, 2 hours, I get the munchies. I need something, right? Or you have the experience where your sugars feel like they plummet, right? That sort of jittery, headaches, feeling terrible. Those are signs of insulin resistance. And insulin resistance is particularly challenging because it leads to more problems. It leads to chronic problems with our body. More weight gain, inflammation, which we'll hear about soon, fatigue, high sugars, prediabetes or type 2 diabetes, high triglycerides, low HDL, blood pressure goes up, increased risk of heart disease, fatty liver, inflammation of the liver, cirrhosis, irregular periods, infertility, PCOS or polycystic ovarian syndrome, gout. The list goes on. All right, so if you know anybody with any of these concerns, this is part of insulin resistance, and it's the picture that we're going after with diet. So there is a plan that works, and that's what we're going to talk about now. Your body starts out in a perfect state every morning when you wake up. In a fasted state, your body's metabolism is in a great state. You don't feel too hungry or too full. Most people, when they wake up, they don't have to fight their way to the refrigerator. They can pee first, they can brush their teeth, they might be able to change their clothes before they go and eat. And some people will say, I'm not even hungry for breakfast, right? And that's because you're in this perfect metabolic state. So the good news is we can actually stay there, right? How can you keep your body in this perfect state all the time? That would help. That would be called intermittent fasting then. All right? Awesome. So I put in parentheses vary, but we're talking about low-carb or ketogenic diets. All right? That's how you can stay in this state. What are we told we should be having for breakfast? Orange juice, cereal, whole grains. That's not on this list, right? Because that would throw us right out of that metabolic perfect state that your body knows how to be in. Here's what we're talking about. Oops, let's go back one more. So, just to make sure we're all on the same wavelength for definitions, low carb and ketogenic diets. So keto diets, which you've probably heard a lot about, are high fat, adequate protein, and very low carbohydrate diets, and it puts the body into a state of ketosis. Ketosis is when the body is burning fat for fuel. It is not the same, and it is not dangerous. It's not the same as diabetic ketoacidosis. And many people do not know the difference between those because they have similar words in them, okay? But all of you now will be the smartest people on the planet, right? You're going to be walking around out there and you're going to know this. Low carb in the literature or in medical journals when they compare different kinds of diets, low carb is anything under 130 grams of carbs per day, and it has to be less than 45% of the daily calories. Let me just say, that is not low carb in my book, right? That would be considered high carb, but relative to the standard American diet, that's low carb. So when you hear these headlines like low carb's not really that helpful or something like that, that might be what they're talking about, is still a relatively high carb diet. Ketogenic, very low carb or induction phases of many diets are when the carbs are around 20 grams and upwards of 50 grams per day. Okay, so that's different. Examples of those diets include like Atkins, Banting, Paleo, South Beach, and currently we hear a lot about keto diets, right? It's become very well known. All of those diets work well with intermittent fasting as well because your body naturally can go for periods of time without eating if you have access to your fat cells. So let's just review. Now that we have all this awesome knowledge, and all of you will be the smartest people on the planet out there, how does insulin affect weight? Just to summarize, remember, we're talking about here achieving normal blood glucose levels. That's what the body wants, this full tank of gas. Not too much, not too little, all right? And so if your blood sugars are high, your pancreas pumps out insulin, and we know high insulin stops fat burning and it starts growing those fat cells because it's using up the sugars for fuel, and then it gives you this normal blood glucose. On the other hand, low blood glucose, the pancreas pumps out glucagon, which allows your body to turn on fat burning because you have this low level of insulin, and fat on your body is now being used for fuel, all right? Okay, So that allows you to achieve this normal blood glucose. So if you eat sugars and carbs, that raises your blood sugars and it makes it hard to lose weight. If, on the other hand, you are going to have this very low carb or ketogenic diet, you're going to be able to burn fat and you're going to lose weight. So the goal is to not have the sugars and the carbs and to eat very low carb or ketogenic if you want to have a healthy weight. All right, so we already know what our healthy, very low carb diets look like, and I'm afraid some of this has dropped off the screen. Our entire goal is to feel healthy, to be healthy, to eat for health. And so remember this picture of this little kid wearing the superhero costume, because we've all been there and that's what we've all started out wanting to do. So what I want to end with real quick here, you're going to see throughout the day that there's many reasons that we want to eat very low carb or ketogenic, and it's going to be these naturally colorful foods. As I've given you a flood of information, I want to share a patient story with you. And this is somebody who struggled with weight. He was a 62-year-old male, and he struggled with obesity for many, many years. And he went through some very extreme measures to try and lose weight. And in fact, he lost so much weight with all these extreme measures and procedures that he started feeling really unwell. He came to see me, and he did not look good. He looked very malnourished, very unhappy. He was very hostile and angry to all my staff and to me. And I said, "What brought you in to come and see me?" And he said, "My doctor, I've been around the country. I've gone to Mayo Clinic. I've gone to Harvard. I've gone everywhere they're the experts. And nobody is able to tell me what's wrong with me. I've had every tube shoved into every part of my body, and I feel terrible. But my doctor told me, go see her. I don't know what she does, but she does something, and she can handle some of these really complicated cases that we haven't really figured out what's going on. I don't even need to know what it is. Just go see her and see what she'll do." So he was really pissed off, unhappy to be in my office, and he's like, "I know you're not going to be able to help me. Who are you?" So I wasn't sure I could help him either. But I know the human body is designed to heal. And I know that if we give it the right environment, it can do that. And so what I decided to do was feed him nutrients that would help his body. They would be all the essential nutrients that a human body needs. And take away the nutrients that might not be nutrients, right? All the toxins in his body. So what did I do? Naturally, that's a ketogenic diet, right? So I said, okay, your BMI is 19, so you don't need to be on a diet, but you need to give your body that environment. So I put him on a ketogenic diet, and every week I assessed how he was doing. He got better and better. After several weeks, he was smiling, joking with my staff. He started going out with his friends again. His hair stopped falling out. He started being able to eat with other people. He was enjoying his life, and he re-engaged, and he started traveling. And now he's bought several houses all over the place so that he can travel and enjoy his time. So the ketogenic diet is not just for weight loss, it's for health optimization. And I think that's really important to understand that. So you can choose to eat well for peak performance. And now, all day today, this day is designed for all of you to be able to do that. So thank you very much.